Hi everyone. So today we're going to discuss a very important antibiotic known as vancomycin. Now, vancomycin, it belongs to the group of drug known as glycopeptides. And where do we obtain this drug? We obtain this from bacteria in the soil, especially actinomycetes. Okay, so these are the bacteria which are the source of this antibiotic molecule, and which bacteria specifically, earlier it was known as streptomyces or nocardia, but the recent name is a mycolatopsis. Orientalis. So this is the source of the molecule vancomycin. And there is another glycopeptide which is also known as teicoplanin, which is as important as vancomycin, and these two molecules, they belong to this class glycopeptides. Okay, now let us understand what is the mechanism of action of this vancomycin. So you have to first understand that it is a cell wall synthesis inhibitor. But how do it inhibit cell wall synthesis? That is the most interesting part. So let's draw something. So the vancomycin target is this two amino acid molecules known as D-alanine, and they're joined together. So our drug vancomycin, it go and binds to this D-alanine, and this binding is very rapid and it is irreversible. So the vancomycin, it goes and binds to D-alanine. And where does this D-alanine? It is there in peptidoglycan. Now, if we know, the peptidoglycan is basically the two molecules are there. One is known as NAM, another is known as NAG, and acetylmurahmanic acid and N-acetylglucosamine. And to this NAM, there is attachment of 5 amino acids, and last two are this D-alanine, and that is the binding site for this drug. So initially these two amino acids, they are separate, and then with an van gene codes for a ligase enzyme in bacteria, and this ligase will form this dipeptide structure of D-alanine in the alanine, which then attaches to this tripeptide molecule which is on this NAM energy, and form the pentapeptide side chain, because it has 1, 2, 3, 4 and 5 amino acid molecules, right? So I'm taking it very slowly so that we understand its mechanism very thoroughly. Okay, So don't rush yourself while understanding the mechanism. Now what happens is that this pentapeptide side chain, it is very crucial, especially this fourth amino acid, which is D-alanine, because it will bind to the third amino acid. Okay, of the next chain. So fourth of this will bind to the third of next chain. So this is our NAG, NAM. So this is another peptidoglycan chain. So, and this will happen with use of a bridge made up of 5 glycine molecule, and this bridge is known as pentaglycine bridge. This we are talking normal peptidoglycan formation at present, but because the vancomycin has bind to this D-alanine, now due to the steric hindrances of this molecule, this cannot happen. So the crucial cross-linking of this side chain will not happen. So what does vancomycin do? It will inhibit the cross linking of side chain. Okay. So this pentaglycine bridge will also not form, because vancomycin will also inhibit the transpeptidase as well as carboxypeptidase, which will also culminate in the same thing. It will not allow cross-linking. And due to this, what will happen? The subsequent precursor of trans glycolase will not happen. So this will not attach to this, and that will lead to weak cell wall and bacteria will die. So that is the mechanism of action of vancomycin. In Staphylococcus aureus, we have seen additional mechanism that it increases cell membrane permeability as well as it inhibit RNA synthesis. Okay. If we talk about vancomycin and we talk about its spectrum, mostly it will be gram positive bacteria. Now that will include all important gram positive cocci that you can think of, like Staphylococcus aureus. But one thing has to be remembered, its effectiveness is better on MRSA. For MSSA, it is effective, but it is less effective than the simple cloxacillin. So we prefer it for MRSA. All cones, including MR cones, that is coagulase negative staphylococci, your all streptococcus and all enterococci. Now One thing I would like to mention, vancomycin is bactericidal because it kills bacteria by inhibiting salvosynthesis. But for enterococci, it is not. It is not. It is an exception. So it is not bactericidal. So if you want to achieve this effect, then you have to combine amino glycoside with it. So you need another drug to achieve this bactericidal effect. So yes, the first spectrum is all gram-positive cocci. It is also effective on gram-positive bacilli. For example, cornybacteria, all Cornybacterium diphtheria, Cornybacterium jacum, Listeria, monocytogenes, all bacillus species like Anthracis, right, CDS, right, and even some lactobacillus also are that is effective. Even anaerobic GPB, that is also inhibited. For example, actinomyces in cocci, streptococcus, or Cutibacterium acne, also known as previously Propionibacterium acne, all your Clostridium species, mainly difficile, perfringens, botulinum, septicum, ramosum, so this is excellent. It has a very good gram positive spectrum, but it is not effective on few gram positive. So some gram positive cocci, it is useless because they are intrinsically resistant, like leuconostoc, right, pediococcus, enterococcus, two species, enterococcus gallinatum and casselliflavus. Right. So if we talk about GPB, then Clostridium inoculum or Acipelothrix rusipethiae, some lactobacillus, I think most of them. Right, so these are all resistant, intrinsically resistant gram positive cocci and gram positive bacilli. Right. Now, interesting thing, it has no action on all gram negative bacteria. So all gram negative vancomycin will not work. It is intrinsically resistant due to permeability issue. For gram positive, it is not permeability issue, but the PG precursor is altered. So here it is altered peptidoglycan precursor. So there is no binding site. That is the reason, right? While here it cannot enter because of its large size from pouring. Okay, so that is the cause. But I would like to tell you an exception to exception, that among few gram negative, it will still work. Let us give you an example like Elizabeth Kingia, in which vancomycin is working. And there are no breakpoints though, but in neonatal meningitis, we can give it along with rifampicin. For Neisseria or the Lyme disease, Borrelia burgdorferi, it appear in vivo it is effective, but in fact it is not. So in vivo, no, actually there is no effect, but this is a genuine exception, Elizabeth Kingia, for which vancomycin is used therapeutically, though it is a gram negative bacillus, right? So I think I will keep it up to here. In next video, we will discuss its pharmacokinetic and pharmacodynamic parameters along with uses and side effects. And that will complete this video. So till next time, bye-bye.